and welcome to Nutrition Moments. Here we talk about what we eat, what we nourish our body with to stay healthy. I am Fadila Okunu. Let's start with recent events and developments in the field of nutrition on Nutri News. Today we are exploring debt in our environment and how it affects our nutrition and health. Let's kick debt and hug life on Nutrilens.
Debt in our environment can be a breeding ground for diseases, from contaminated water through unmaintained sewage, unhygienic food preparation, unclean commodity markets, unsanitized abattoirs to poor waste management. Debt can have serious consequences on our health. Dirt can contain harmful substances, including heavy metals, pathogens, and chemicals that can contaminate food and water sources. This exposure can be a direct risk to human health and can indirectly affect nutritional status by making food sources unsafe to consume or diminishing the availability of safe water. High levels of environmental pollutants can make it difficult to access and consume healthy food, thereby influencing diet quality, exposing unsuspecting victims to harmful pathogens. This can lead to diarrhea, malnutrition, and even life-threatening diseases.
Because of the poor waste management in some of these suburbs, overpopulation, these areas are susceptible to pollution. And pollution, talk about air pollution, people want to burn their waste, they can't afford to do the normal collection of the waste, and they burn. Air pollution will lead to airway problems, respiratory diseases in children. It will lead to fecal-oral transmission of diseases. We've talked about polio, cholera. All these are problems that could emanate from poor waste management and pollution challenges. How do we sort our waste? How much waste is being generated by this teeming population? And then the limited access to clean water. Because we have limited access to clean water, then people would take all from different water from different water sources. People would go for open defecation because you need water, of course, to flush through the proper sanitary methods. But if these are not available, people do open defecation. This affects our food security. It affects the food we consume. So there is diarrheal diseases amongst the people, and more especially among the vulnerable population, the children and the women who are at risk in this region. And then it results in malnutrition. And it becomes a vicious cycle. A malnourished mother will give birth to a malnourished baby prone to different problems, leading to cholera, diarrheal diseases, failure to thrive, and death. And so we have high cases of infant mortality death, high cases of maternal mortality rate, and this brings us far away from the sustainable developmental goals which we seek to attain before 2030. Lagos has been faced with cases of flooding in recent times because of the climate change and then the waste management that people pour in pet products, nylon, dirt in waterways, and this causes problems with drainages and then leading to flooding. Yes, Lagos State is trying, providing water, providing amenities, but then we have too many people for the limited resources. This poses threat to the health of the people, and this inadequate infrastructure forces the community to go for unsafe water sources and practice, yes, open defecation that I already mentioned. So this leads to high risk for diarrhea, waterborne diseases, exposure to typhoid fever, rotavirus, even though we have vaccines against these diseases, but then prevention is always better than to cure. And then it leads to frequent infection and failure to thrive in these children. Children who are susceptible to diarrhea, who are having in and out of hospital, in and out of having diarrhea at different times, they are prone to malnourishment. And when they are malnourished, they could be stunted, which is that they have low height for age, or they might be wasted, which means they have low weight for the height. And when they have these features of malnourishment, it's a problem to them. It's a problem they face. They are not able to keep up with their mates. They come back, they have poor IQ, and then it's a vicious cycle. With poor IQ, you're not able to make ends meet. Then the recurrent illnesses poses economic threats to the families that they are from. And so the cascade of poverty continues in this group of people.
Promoting community resilience to environmental protection, nutrition, and hygiene is crucial, especially in peri-urban communities in Lagos State.
At home, there are some things that the children will do, or maybe if you buy meat and all that, if you're teaching them how to wash it, after washing it, make sure you clean up, wash the place very well. Because personally, physically, we might not see the germs, the bacteria, that on those meats. We might not take care to make sure that we wash properly and take care of those things. So personally, in terms of health, if the environment is bad, we might not see it with our physical eyes, but the things we are buying are already contaminated. Whether we like it or yes, it's there. And so it affects us, it affects our health. And if it affects our health, it also affects our life.
Proper waste disposal, the R's, the 3 R's. You are recycling, you're reusing, you are reducing waste at the point of the generation. We talk about water safety. If there are adequate protection of social amenities like water, and then people will not go for open defecation. And so the water will be safe for consumption, the water will be safe, and people will live a good life. You have to eat all the classes of food in the proportions that they are expected. You have fruits, vegetables in your diet, take carbohydrates. All the classes of food must be represented in each meal, and take lots of water. Hand washing, wash your hand each time you use the restroom, for example. Each time you touch raw food, why you should wash your hand. How to manage your food so that you do not store raw food and cooked food together. How you store your food in the different temperatures, and then we would have lesser diarrheal diseases on our hands to deal with.
Fortunately, there are organizations working tirelessly to promote environmental protection, nutrition, and hygiene in our communities. These efforts are making a real difference in the lives of community members. By working together, communities can create healthier environments, improve nutrition, and reduce risk of diseases.
We sincerely acknowledge and commend the Lagos State government's efforts in sanitizing the markets and emphasize the importance of citizens adhering to the state government sanitation directives. Hereway calls on all relevant stakeholders, government, civil society, market authorities, media, and private sector actors to respond decisively to the urgent sanitation and hygiene crisis threatening Nigeria's traditional food markets. The time for fragmented, low-impact interventions is over. The situation demands a unified, well-resourced, and accountable approach. To this end, we call for the following. substantially increase financing for wash infrastructure in markets. We urge federal, state, and local governments to allocate and release dedicated budget lines for constructing and maintaining essential wash facilities in traditional markets. These include gender-sensitive public toilets, functional water points, safe hand washing stations, and structured waste disposal systems. Market vendors and consumers deserve clean, dignified spaces that support health, safety, and economic activities. There should be clear institutionalized collaboration between relevant ministries such as the Ministry of the Environment, Health, Agriculture, Primary Health Care Board, and Rural Development to harmonize standards, share data, and jointly monitor hygiene compliance across markets. We call on government development partners, NGOs, and market unions to invest in continuous community-driven BCC strategies that empower market traders, consumers, and environmental workers to understand and adopt hygiene-conscious behaviors delivered in local languages and through culturally relevant platforms.
By promoting initiatives like this, we can create healthier and more resilient communities.
By taking collective action towards environmental protection, nutrition, and hygiene, we can make a big impact on our health and well-being. Follow us on our social media handles. It's right there on the screen. Don't forget to like, subscribe, and hit the notification button for more. Till we meet next week, bye for now.